Hi, this is Ming Chu. I'm the injury guru. I'm a physical therapist here in New York City, and I am the author of the self-help book called The Permanent Pain Cure, and I specialize in soft tissue and myofascial treatments. Today, I want to talk about meniscus injuries, meniscal tears, and how to treat it, and the ramifications of doing surgery if you have a meniscus tear. I've somehow, unfortunately, had become an expert at meniscal tears because I had two meniscal tears, one on my left and one on my right. And the one I had on my left knee was pretty severe. Happened about 4 years ago when I was moving something very heavy, and I heard my knee pop like 3 or 4 times, and my knee shifted. And ironically, it did not even hurt when it actually happened. But about 10 minutes later, my knee swelled up to the size of maybe a third of an orange if you put it on the inside of my knee. And it was pretty frightening, and it was kind of shocking. And I decided to call a friend of mine. She's an excellent physical therapist. And I asked her, and I told her exactly all of my symptoms. And she said to me, "Dude, you definitely tore your meniscus." And I knew it already. I just wanted to hear it from her. So, the thing was pretty painful. It was hard to extend and flex the knee without clicking and popping. It was very painful. It was about level 8 out of 10 pain. There was significant amounts of swelling, and the thing just looked pretty darn awful, and it felt pretty awful. But I didn't panic. I thought, worst comes to worst, I would have to do a surgery on this knee, but I had access to putting all these modalities on my knee. The first thing I started out with was a microcurrent machine, of which I set it for a frequency that was specific to an acute injury like I just had. Then I made sure I was hydrating properly. I always do, but I made sure I was drinking at least 3 liters of water, fresh, pure water, every single day, starting at that point. And I also added 4 tablespoons of powdered collagen, 2 teaspoons of this product called Baxil, which is liquid hyaluronic acid. And I also was using about 16 to 20 pills of this product called Joint Support, made by Dr. Mauro Di Pasquale. I have spoken about this product in other video posts. And I also was taking 1 teaspoon of powdered MSM, which I also talked about as well. And I did this for at least a month. And the great thing was, within a few days, my pain went from a level 8 pain down to about a level 4 or 5. So I stopped limping for sure, but it was still very, very, very painful. And I distinctly remember around week 5 or 6, the pain in my knee actually woke me up one night, where I felt throbbing pain for 3 consecutive nights. And I just intuitively knew that the knee was actually healing, and it was just suturing and healing up at that time, and that's why it was feeling as such. I didn't panic. In fact, I thought it was a good thing, and the swelling was down significantly. My range of motion came back. The clicking and the popping dramatically improved as well in the first 2 weeks. So I felt I was coming along very nicely. By using these supplements and doing the hydration, I felt that I was giving the knee the raw materials to heal. Now, had I done surgery, they probably would have found like a piece of meniscus that was flapping out and probably blocking the knee that was causing the clicking and the popping, as well as the swelling. I'm going to show you this very crude picture that I drew. And this is what a meniscus looks like. And if you see over here, this is, let's say, a meniscus that got torn, and you can see the flapping of this little part here. According to doctors, that can cause the blocking up of the knee and all the pain. But what is their solution? Their solution is to cut the whole thing out, and it looks like that. So here's the thing now. What was previously a meniscus that was torn, now it's a meniscus that doesn't have the flap, but the surface area of your bone on bone has actually increased, meaning that there's less cushion, there's less protection of your femur grinding into your tibia. So I never really understood why a surgery would be done as such, because it seems counterintuitive to take out something that it was designed for cushioning. I say, consider doing what I did, which was to basically give it the right raw materials to start it to heal again. I also wanted to mention, aside from doing the supplements and the water, I also, on week 2 or 3, when the pain levels went below a 4, I started riding a recumbent bike for about 10 minutes on a very light, easy pace with very little weight and very little tension on my legs. I was concerned not to put too much wear and tear on the knee, but I wanted to increase the blood supply and the blood flow into the knee. I also, during this period, was putting a heating pad on my knee. I never ever used ice, because ice, as you may have seen in my other posts, I talk about how ice actually impairs the natural healing process. So during this week, it was about the second and third week, I started using the heating pad. On the third and fourth week, I started using the recumbent bike to get some more blood flow. And it's also said that about 70% of the healing of the meniscus comes from just diffusion of nutrients that comes right into the knee, because the blood supply going into the meniscus is actually kind of a compromised or a very slow blood supply because of the nature of the tissue, that it would take a long time for that area to heal if you didn't get enough of this blood. So my logic was to increase the blood flow by moving the joint, so there's fluid flow as well as blood flow to accelerate the healing process. And apparently it worked very well on me, because pretty much by the end of the 5th week, my pain levels that was previously an 8 on day 1, day 2, went down to like a 3, 4. It was dramatically better after a few weeks. And after about 8 weeks or so, the pain went down to like a 1, 2. And it kind of stayed at a 1, 2 for another few more weeks. By the time it reached week 12, the pain was close to like a 0 to a 0.5. So I pretty much healed myself within 8 to 10 weeks of doing this. And pretty much after the 12th week, it felt pretty much as good as new. So the purpose of this video is to suggest that you perhaps want to try a more conservative approach before just jumping into getting surgery. Think about what you're going to do, because if they're going to cut a piece of meniscus out, wouldn't that be counterintuitive, and it will cause more of a bone-on-bone situation, which would make the situation worse. So think about that before you get any type of surgery for your meniscus like that. I also wanted to add that there was a study that was done a few years ago when they did a sham surgery where they put patients under and they put 2 holes into the knee, and they followed the patients up, and they found out the sham patients, compared to the patients that actually got meniscal surgery, the outcome was pretty much the same, which suggests that either the sham surgeries, the placebo effect of doing surgeries makes the patient believe that their knee was going to get better, so they actually got better. So it goes to show you that surgeries may not be the solution, and the mind can be very, very powerful. But I say, if you do the supplements, the water, you get somehow to get the blood flow into that knee area by way of heating pads or doing recumbent bikes, you can get really good results without doing any surgery. So I just wanted to share that with you. Now, this video is not intended for you to not get true medical advice, but I wanted to share this story with you that had actually happened to me. And I have patients right now that I'm treating that have similar situations, and I'm using the exact same approach. And so far, this patient I have recently, he claims that his knee is about 70% better after about the 5th appointment. And so I'm hoping he'll continue to improve. So hopefully this video will give you a different look on how to address meniscal issues, and perhaps reconsider before jumping into getting a surgery right away to try other methods of healing. So this is Ming Chu, the injury guru, physical therapist here in New York, signing off, and good luck. And I hope this video will help your knees. Take care.